online course, corrective techniques for movement dysfunction?
Yes.
Have a seat for me. Today we're going to talk about rotation and rotational corrective activity. First thing we're going to do is we're going to check to see how much thoracolumbar rotation he has. So we have to make sure that he has at least 30 degrees in order to pass this set movement assessment before we can move on to the rolling assessments later on. So go ahead and rotate to your right. Good. Feet together for me. Feet together. Good. Rotate to the right. I'm going to apply a little bit of overpressure to make sure he's at end range and ask him to hold that position. And he's currently at 65 degrees of right thoracolumbar rotation. Go ahead and rotate the other way. And again, end range, hold there. Making sure that I'm lined up appropriately. And about 63 degrees, so he's very, very close. And as a thrower, we expect him to be fairly equal bilaterally. Go ahead and stand up. And lay down flat on your back. Here, go ahead and spin the other way for me. So now, because we know that his mobility is appropriate to be able to complete the rolling assessment, we can move on to this rolling assessment. So we have him in the correct starting position here, and the first movement he's going to do is a supine to prone roll, leading with the right upper extremity. So go ahead and come across from the right. And the first time as I'm assessing this, I'm not going to instruct him. And now he's going to do a prone to supine roll, leading with the right upper extremity. Good. Supine to pro, leading with the the left upper extremity. Good. And prone to supine roll with the left upper extremity. Now, this particular athlete does have a history of right shoulder problems, so we are going to really focus on his right shoulder and the upper extremity for the purposes of this assessment. So Trip, now what I want you to do is I want you to do that supine to prone roll, leading with the right upper extremity. I want you to tuck your chin into your armpit as you're rolling, leading with the right side, and really try to extend up through. Yep, coming to the right. You can see this already, this cueing allows him to correct some of his rolling as he extends through and elongates his axis. Now as you go back, I want you to extend the head and look away from, kind of extend your head back towards the direction you're going, leading with the right upper extremity. Good. And this cueing allows him to get in position. As his head travels, his body will follow wherever his head goes. Now go ahead, one way we can move on progression aside from just cueing with some of this activity is we can make sure that his scapula is stable and able to have good scapular control. So let's go quadruped position for me. And we did this a little bit earlier, but what I'm going to do is I'm going to have him hold one side here, the tubing, come around his feet, tuck in. It's maybe a little bit short. Let's see, hold the tubing there. That's good. And hopefully this doesn't snap on him. That'll be that. Okay. So the first thing we're going to do is I'm going to provide cueing with my hands, and I'm going to hold it, make sure his scapula stays stable, and you're just going to reach out as far as you can towards the table for me with your right arm. Good. 4 more. 2, 3, 4, 5. Good. Coming over to the left side. 5 good ones. Straight out. Straight out. 2, 3, 4, 5. And we could tell the first time you wanted to kind of kick out, his scapula wasn't quite stable, so we're able to kind of keep him stable. Once we've gotten through that, we can then add the feet into the equation, slightly changing the center of gravity. So we're going to go opposite arm, opposite leg like we did the first week. Go ahead and reach and then kick out with the back leg on the left. Good. The tubing just adds resistance and feedback for him as he can feel how his body's reacting. 2 more. 4, good. Reach all the way back out, good. One more. Very nice, very nice. Now, there you go. And same thing on the other side. I'm gonna get over to the opposite side, go ahead. Good. 3, 4, good. And we can use various degrees of tubing with this, but this also helps engage his pelvis and his core, both his inner and outer core muscles, in order to complete the rolling activity. Once we've established this from the upper extremity, give me the band, back. We can then provide some feedback, especially from prone to supine and supine to prone. So from a prone to supine standpoint, the next thing we could do is actually add manual feedback as he goes through into, so go ahead and lay on your stomach. So as he's going, since he has a right-handed thrower, good position here. So you're gonna, this is gonna be a prone to supine roll leading with the right upper extremity. I'm gonna add feedback with my hands for him, and what he's going to do is use the scap to drive back and across and roll leading with the right upper extremity. Go ahead, and you can tell that, good, just like that, very nice. And that allows him to have that feedback going forward. Again, go back on your stomach for me. And we're gonna go the same thing, but to the left. Again, feedback on the scap. Good, and back forward the other way. Now, the reason I would do this second is because we've already established that scapular control using the band. We have established the pelvic control using the quadruped position, and then we can establish this neuromuscular control from the upper extremity using our feedback from the scap. This should allow us to be able to have good rotational ability and engage the core in conjunction with our breathing techniques that we did previously moving forward. Now the last thing we could do is use kind of a half foam roller to help facilitate. Go ahead and lay her back. And this should help facilitate rotational, get this underneath. And now to the top. Right. Get them in a good starting position. Now you're going to roll. I want you to lead with the right upper extremity. And what he's going to do as he rolls across, this should help facilitate the roll from the right to the left, from supine to prone, leading with the right upper extremity. Go ahead. And as he rolls off the foam roller, this should help come back. Good. Now we can go also, we can show this from the left side. And I like to do it just a little bit off center. If he's right in the middle, it really doesn't give him the same feedback, but this puts him a little bit tilted to start with without the feedback from me. Going from supine to prone, go ahead with the left side, left to right. Good. Coming back. And it also allows him the feedback landing back on the foam.